All right, ladies, gentlemen, if you are concerned about aging and the signs of aging, whether that be from sun, just wrinkles, we're here to tell you about a laser that's been tried and true at Academic Alliance in Dermatology, again with Dr. McMeekin. Always so good to see you.
Nice
Good morning,
to see you.
Doctor.
Good morning.
So let's talk about this laser. What I love about this is it's been around for quite some time. We're going to talk a little bit about the technology, but again, tried and true. People are loving you as well, Doctor, the results that people are seeing.
Yes. If I had to pick one device that we have, and we have multiple devices for skin rejuvenation, this is the premier one. It has very little downtime.
Okay.
The wounds heal in 5 to 7 days. They heal quicker. And it's done in the office with just local topical anesthesia and some injections. And it's very safe, very few problems. The old lasers, which I used for about 3 decades, would remove the entire epidermis and then you treated the dermis. But they take 7 or 10 days to heal. It'll be red for 6 or 8 weeks. They had an unnecessary risk of pigmentation changes. And this all changed in 2004 when one of the Harvard dermatologists invented this fractional concept. It's called fractional photothermolysis. And this laser is based on that.
Yeah.
You basically treat a fraction of the skin, and therefore it heals quicker with less side effects.
It was interesting. I was asking the doctor before we got started. I said, well, why would you use anything else? And you said, you really don't. I mean, for this, talk about the issues that this really targets, who the ideal candidate would be for this.
The ideal candidate is someone who wants to improve their appearance. They may have some early fine lines or wrinkles. Mm-hmm. They may have some damage with discoloration or pigmentation. Or they may have some leftover scars, say from old Accutane therapy.
Okay.
And this laser will target all of that. Photo damage, wrinkles, scarring with one treatment.
So you mentioned downtime. There is a little bit of downtime, which, I mean, for the results, it seems like it's worth that. But talk about what that downtime is. What do people typically do?
Well, the wounds are not dressed with dressings. Mm-hmm. Their ointments are put on them daily. That helps it heal faster. We use several compounds by a company, the Elastin, that makes ointments and salves and nectars that speed the healing. And the typical downtime of the skin is a little red and it weeps a little bit until it heals over in about 5 to 6 days. Okay. So I tell patients if they have a 9 to 5 job 5 days a week, take those 5 days off, and by the next Monday they can go back to work with just a little makeup.
You know, I think there's, it can be a little overwhelming when someone does say, you know what, I'm ready to kind of make that next step and maybe start to look a little younger, you know, of how I'm feeling on the inside. But there is a lot to choose from. What would you say to people watching today that are kind of going to embark on that next journey?
Well, I think the consumer should get other opinions, mm-hmm. Consults about other devices and things. We also do microneedling. We do non-ablative resurfacing, which means the skin, it doesn't peel, doesn't have any downtime. Mm-hmm. But those treatments generally give a modest improvement. This gives a more moderate improvement mm-hmm. with very little sacrifice in time.
All right. Well, what's your take home for people watching this morning, again, is they're maybe making some decisions for themselves or, again, starting?
Well, I think this is a safe, proven technology with very little risk, and it's done in the office. And I think anyone who wants to improve their appearance or get rid of some sun damage, mm-hmm. this is an ideal treatment.
Are you seeing both men and women come in for this treatment?
Women more than men, but
yeah.
both.
Yeah.
Both.
Well, Dr. McMeekin, I always love visiting with you. I learned so much from you and the team, so we appreciate your time this morning.
Thank you very much.
All right. And of course, if you have any questions, you can certainly go to their website, and we'll make sure that info gets on our website as well.